Thank you very much. Good afternoon, everybody. Dear ladies and gentlemen, I think that these are the very days when a whole new plan is taking shape. My colleagues are just starting in 10 minutes the first round of fights at cabinet level. We hope to survive that safe and sound. And hopefully next Tuesday, you will see back everything that I'm going to tell you about. And yes, I take it very seriously when it comes to cardiovascular health, because I think that we have wasted far too much in terms of time and also in terms of energy and in terms of focus instead of addressing the leading cause of death in Europe. And I'm talking about Europe. I'm not talking about the European Union only, because if you look around our continent, it is the case that we're losing way too many lives to these diseases. Only in the European Union, we're losing 1.7 million lives every year. And needless to tell you, because basically you are the ones experiencing all this, that 80% of these lives could be saved. So we should try and save it, and save at least 80% of these lives. We also see the tremendous social and economic cost of these diseases. We have tried to quantify it, and it seems that it is anything around 282 billion euros of a cost every year to our social system, to our healthcare system, and to the society at large. And needless to say that behind each and every story, there is a family, there is someone suffering, there is someone lost for a cause that we could prevent and we should prevent. And the numbers don't lie, because what we also see is that we are at the brink of a tendency that this can get very quick and very massively worse. If you look at the public health figures related to the young generation, what you see is alarming. Alarming because you see that the rate of people being overweight or having obesity or struggling with diabetes have gone up in the whole society sharply above 30%. So more than 1/3 of the population. These are clear risk factors to cardiovascular disease. But even more alarmingly, in the young generation, in the under 15s, we see that 30% of them are already overweight or obese. And 20% of this generation is either already in diabetes or entering diabetes too. These are not numbers that can be exaggerated. These are facts that are not only alarming, but I hope they're also going to be sobering for all of us. Because we see that people who have good cardiovascular health, on average, can live 8 years longer, on average. 8 years of life we can save for everybody. So I think I cannot argue more the case why we need to act now. We need to think hard and very deep to be able to help the people, because it is not only a medical question, it is also a question of choices people are making every day. And this is where I think we have the biggest shortcoming in public health policy. Because we see that these numbers are worsening, which means that we have less and less impact on the choices people make every day. What they eat, what they drink, whether they do sports, what is the lifestyle they are following, or whether they are in knowledge of the personal risks that they are living with. A year ago, I have expressed my strong intention to adopt, therefore, the first ever EU Cardiovascular Health Plan. And next week, I hope I can trust my colleagues in the college, we will get it adopted, and it will be baptized under the name Safe Hearts Plan. This plan will provide us for the very first time a coordinated approach at the EU level, which is the best way to address these problems, and also to raise the awareness of everybody about the tremendous risks that we are all running at society level. This is also the best way to reduce the inequalities, because if you look at, in terms of the structures in the society and the level of exposure dependent on the place in the society of the people, you see also that the risks are completely different. So we need to give solutions at all levels and to everyone affected by this risk. Right now, 14 member states don't even have a national plan or strategy dedicated to cardiovascular plan. So more than half of the member states of the European Union. This plan should also help the member states to develop their own and update, if they have one, their own. The Safe Hearts Plan is based on a successful approach of the Europe Beating Cancer Plan. It will span from prevention, early detection and screening, and it will bring treatment and care, and it should include, of course, also rehabilitation, because the journey does not always end when you leave the hospital. In most cases, it never ends. It will also address the triangle, which we have talked a lot I see very many familiar faces in the room. When I've seen you and met you, we agreed that this is a triangle. This is a triangle of cardiovascular diseases, obesity, and diabetes, because they are closely related to one another, and they largely influence one another. And this is why we will want to address all three of them together. The plan will have an ambitious prevention pillar. And that is important for me because if you are looking at the risk factors and if you are looking at the choices people are making, I think this is where we can make a difference, and this is where I think we must make a difference. High blood pressure, high cholesterol, diabetes, obesity, smoking, and I could go on. These are all proven risk factors, not to mention ultra-processed food or the other risk factors that are also well known. But millions of Europeans do not know their own numbers or don't even know how important these numbers are. They don't know if they have a high blood pressure. They don't know if they have a high cholesterol level. They don't know if they have a high blood sugar level. Most people we see being screened at random are actually having some condition. What we have seen in member states where they are rolling out such broad screening programs is that 60% in Central Europe, 60% of the people have one condition out of the 4 big numbers that we discussed. 60%, and these people are just out there, not in hospitals, not under care, not under control of their diseases. So we need the people to be better informed so that they can reduce themselves the risks to themselves and to their families. And that means knowing their numbers so they can act already now before trouble hits them. A special focus would be also on developing, of course, health checks for the cardiovascular diseases so that the health system can more easily identify the people at risk, but also can much earlier prepare to care for them and prepare to prevent their diseases. This will be addressed through an EU protocol on health checks for cardiovascular diseases, the first time ever again. And the protocol will cover both modifiable and other risk factors, because the plan will leave no one behind. Much of our cardiovascular health depends, of course, on making the right choices. And I would never tell people what to do, what to eat, where to go, what is the best to do. But we want to make sure that they all have the information at hand, relevant to themselves, personal to themselves, so that they can make that choice. So we are not about taking choices instead of them, but creating choices for them. To give you one example about this, how to implement this. For instance, evidence-based food information system and the state-of-the-art disease prediction tools will empower the people to make their own personal choices. With this in mind, the plan will encourage, of course, more digital, innovative, and personalized solutions. It should take advantage of the opportunities offered to us by the new technologies, especially when it comes to artificial intelligence and health data created by the European health data space. And for this very reason, we have allocated already 20 million euros from the EU for health funding program this year for developing and deploying AI tools to address cardiovascular and related non-communicable diseases. And this will be followed up with further funding in the coming years. We also want to build on the action we have taken up until now. In July, we proposed to revise the tax rates of tobacco products. The current rules on tobacco are outdated. We all know that. So we want to increase the minimum tax rates. On top of that, products like heated tobacco, vapes, and nicotine pouches have gained enormous popularity, especially, unfortunately, among the young people. These also carry significant health risks, so they will be taxed for the very first time ever. That said, the market is developing, of course, fast. The consumption of heated tobacco more than tripled in the last 5 years, between 2018 and 2023. That is, again, an alarming figure. If protecting the next generation means revising the rates, then we should do it. It also means that we need to, of course, address the other task of us, which is a revision of the rules about tobacco products. And this is something that you will also find back in the cardiovascular plan with very clear targets in this sector. The next big challenge, I think, for any successful cardiovascular plan is to address the gaps in research and innovation. We're working very closely with the Joint Research Center of the Commission and of course, our colleagues dealing with research and innovation in the medical area. And we see that recent, reliable, and comparable data is essential for creating and developing evidence-based policies, state-of-the-art prediction tools, and high-quality medicines and therapies. For instance, in the cardiovascular diseases, it is often said and considered that men are the single biggest risk factors in that. So they are suffering the most risk, or they are exposed to most risks. We need, of course, to research this, but we also see that women are even more exposed. So we will have specific program rolled out also for women to look at the very specific nature of the risks and very specific risks that they are exposed to when it comes to cardiovascular risks. It is also very clear that we need to pick up the work around youth. we see that around, as I said, 1/3 of the youth is already overweight or obese. This means that in 10, 15 years, we will have a whole generation with a condition, suffering from a chronic disease. We have never had that before in Europe. If you look at what is looming on the horizon for us, it's enough to look at the figures now in the US. So we need to have very clear targets also when it comes to the youth, and it has to be very clear that we need to give them much more tools in their hands to be able to make long-term choices, because they can still change very quickly their perspectives, much more than generations who are already in their 50s and 60s. And finally, about implementation. Of course, successful implementation can only be conceived if we have robust funding. And therefore, I think it is important to create long-term funding for this program. We are relentlessly working on a new tool, and we will continue our efforts to create this financing scheme that should create the necessary predictability, stability for this program, because this program must be a long-term venture of the European Union. Maybe it's too early to tell you where our thinking goes, but maybe I can highlight some of our ideas. And that has got to do with the very principle of implementing something that we all know from the environment area, the polluter pays principle. Here we know, if I look at the young generation, where the damage is mainly coming from. So those who are doing the damage should contribute in mitigating the damage or limiting the damage or doing good the damage. It means that we have to develop a system which alerts the people to the risks that they are taking by eating ultra-processed food, and on the other hand, create financial contributions that will make it possible for the healthcare system to prepare for the eventuality of damages in the cardiovascular sector related to the consumption of these foodstuffs. But let me make one thing very, very clear to you. This is not about taking away the choice what people eat. This is not about taking products off the shelf so that Brussels will tell them what to eat. Far from it. It is about identifying for them what products are the ones that can do damage. And if they still want to continue consuming them, of course they can continue to consume them. It's not about fining those who want to continue to consume them, but with a micro levy contributing to mitigating the health impact it has on the whole of the society. And of course, if we are successful in creating such a scheme, we also have to be mindful that this is not about raising money for the budgets. This is about raising funding for the long-term objective of serving the cardiovascular plan. So all the proceeds from these micro-levies should serve the two programs, the main programs of the European Union, the Safe Hearts program and the Europe Beating Cancer plan. These are the flagships that we need as a long-term policy, and they need funding also long-term. So I think as we begin the end of year busy period, basically next week, you will see the very full commitment of this Commission delivering on the single biggest cause of death in Europe. And I hope to count on your support, on your help, also to make the people understand the enormous risk that we are all taking, the enormous risk that maybe we don't see every day, but which we will meet all personally as well. So thank you very much for your support. Thank you very much for your attention.